first question I'd like to ask you, please, is to just identify yourself so that it's recorded. Tell us who you are.
Myself is Dr. Adnan Mohammed Al-Juburi,
And you're
Professor of Medicine.
Indeed.
In College of Medicine,
in
University of Baghdad.
In Baghdad. Thank you very much indeed for speaking to us. Can you tell me why, in your expert opinion, asthma is increasing so badly in Iraq?
Too many reasons available to my knowledge that actually smoking habit is very much increased, specifically with the teenagers and elderly, and I mean all age groups. The second point is air pollution, which is very much obvious these days. The third, maybe reduction in the health service of the country.
What can you do about it as a medical community?
Well, you see, medical services are actually services. I mean, you have to spend more money for this aspect, and I'd like to ask the authority to spend more money on health service so that we can use the mass media and also the way to deal with asthmatics in form of management treatment.
How would you spend the money? What would you do with it?
Well, certainly for improvement of the health. You see, infection is one of the known risk factors for the development of asthma. And if we are able to deal with this aspect by improving the health status in the community, by spending more money on sewage disposal, good refinery for the water, and certainly other aspect of health.
Should the government be doing more by way of legislation?
Yeah, I think yes, and this may hold true for the smoking habit. You know, should be banned in the public. You know, you see, every person can smoke in a place, and you see, if you are sitting in a place where those who smokes, you get what is called passive smoking, and it has the same effect of smoking.
Other countries, certainly European countries, America, have already taken this step. Would
Yes.
you like to see this brought in Iraq?
Certainly, I'd like.
Are you actively doing anything as a medical community to try to make it happen? Are you lobbying government?
Well, I tried hard to talk with my friends who are involved in the parliament and member of the government, tried to make legislation regarding this point.
But would the average Iraqi who smokes, would he obey the rules if he was told he had to?
I don't think. You need more from the side of the mass media is to make the people understand that this is very much important aspect for the health, and I think this is not very much covered by the TV or other mass media.
So more information clearly needed. Doctor, we must leave it there. Professor, we must leave it there. Thank you very much indeed for speaking to us.